Gluten Intolerance, Healthy Alternatives by Jennifer Shapiro for Biology 54, Human Understanding. What is gluten? According to the Celiac Disease Foundation, gluten is a general name for the proteins found in wheat, rye, barley, and tetracholy. During germination, gluten nourishes plant embryos that later affects the elasticity of dough. This is the main purpose of the use of gluten, to help foods maintain their shape, holding food together and giving them a chewiness of texture. As mentioned, common sources of gluten include wheat, barley, rye, and tetracholy. Wheat is commonly found in breads, baked goods, soups, pastas, cereals, sauces, salad dressings, and roux. Barley is commonly found in malt, food colorings, soups, malt vinegar, and beer. Rye is commonly found in rye breads such as pumpernickel, rye beer, and cereals. Tetracholy is a newer grain. It is grown to have a similar quality as wheat and rye together, and can be found in some breads, pastas, and cereals. Intolerance to a substance. According to the Webster Dictionary, the definition of an intolerance is exceptional sensitivity or the inability to properly metabolize or absorb a substance. Gluten intolerance can include celiac disease, dermatitis herpetiformis, and gluten sensitivity. Celiac disease. Celiac disease is also known as coeliac disease, celiac sprue, non-tropical sprue, and gluten sensitivity enteropathy. Celiac disease is an autoimmune disorder or inflammatory disease that can occur in genetically predisposed people where the ingestion of gluten leads to the damage of the microscopic projections of the small intestine called villi. Symptoms can be mild, such as pain complaints, or as severe as major malnutrition. Celiac disease can develop at any age after people start eating foods or medications that contain gluten. If left untreated, celiac disease can lead to additional serious health problems. These include the development of other autoimmune disorders like type 1 diabetes and multiple sclerosis. It can also lead to dermatitis herpetiformis, which is an itchy skin rash, anemia, osteoporosis, infertility, and miscarriage. Neurological conditions like epilepsy and migraines, short stature, and intestinal cancers are also possible long-term side effects if left untreated. Dermatitis herpetiformis, also known as DH or Deuring's disease, is a skin manifestation of celiac disease. Symptoms include extremely itchy bumps or blisters, most often on the elbows, knees, buttocks, and back. The rash is usually the same side and shape on both sides, and the rash can look like eczema, but some patients also have scratch marks instead of blisters. Generally, the rash will begin with young adults after the age of 20, but can be present in children as well, and is seen for both men and women. For testing for dermatitis herpetiformis, a skin biopsy and direct immunofluorescence tests of the skin are performed in most cases. A doctor may also recommend a biopsy of the intestines, and blood tests may be ordered to confirm the diagnosis. For treatment, an antibiotic called dapsone is most effective along with a strict gluten-free diet. This will help control the disease. Sticking to this diet may eliminate the need for medications and prevent later complications. People with dermatitis herpetiformis are also at a greater risk for thyroid disease and are more likely to develop certain cancers of the intestine. Gluten sensitivity. According to the National Foundation for Celiac Awareness, non-celiac gluten sensitivity has been coined to describe those individuals who cannot tolerate gluten and experience symptoms similar to those with celiac disease, but yet who lack the same antibodies and intestinal damage as seen in celiac disease. Early research suggests that non-celiac gluten sensitivity is an innate immune response, as opposed to an adaptive immune response, such as an autoimmune or allergic reaction. Individuals with non-celiac gluten sensitivity have many non-gastrointestinal systems, such as headache, foggy mind, joint pain, and numbness in the legs, arms, or fingers. Symptoms typically appear hours or days after gluten has been ingested. Although similar, gluten sensitivity is much less severe than celiac disease. Determining an intolerance. How do you know if your child has celiac disease? Digestive symptoms are more common in infants and children. The most common are abdominal bloating and pain, chronic diarrhea, vomiting, constipation, pale, foul-smelling or fatty stool, weight loss, fatigue, irritability and behavioral issues, dental enamel defects of the permanent teeth, delayed growth and puberty, short stature, failure to thrive, and attention deficit hyperactivity disorder. How do you know if you have celiac disease? Adults are less likely to have digestive symptoms, with only 1/3 experiencing diarrhea. Adults are more likely to have unexplained iron deficiency anemia, fatigue, bone or joint pain, arthritis, bone loss or osteoporosis, depression or anxiety, tingling numbness of the hands and feet, seizures or migraines, missed menstrual periods, infertility or recurrent miscarriage, canker sores inside the mouth, or the itchy skin rash called dermatitis herpetiformis. Celiac health statistics. Celiac disease is estimated to affect 1 in 100 people worldwide. With the first-degree relative with celiac disease, such as parent, child, or sibling, have a 1 in 10 risk of developing celiac disease. It affects approximately 1% of average healthy Americans. That is roughly 3 million people in our country living with celiac disease. On average, an individual waits 6 to 10 years to be diagnosed. And unfortunately, roughly 97% of them are undiagnosed. Currently, there are no pharmaceutical cures for celiac disease, and only a 100% gluten-free diet is the only treatment. Healthy alternatives. There are healthy alternatives. There are plenty of gluten-free food groups. These include fruits, vegetables, meat, poultry, fish, seafood, dairy, beans, legumes, and nuts. The following grains are other starch-containing foods that are naturally gluten-free. These include rice, cassava, corn, soy, potato, tapioca, sorghum, quinoa, millet, buckwheat groats, arrowroot, amaranth, teff, flax, chia, yucca, gluten-free oats, and nut flours. Conclusion. Gluten is a combination of two proteins, gliadin and glutenin, and it is found in wheat, barley, rye, and tetracholy. Having an intolerance to gluten can result in celiac disease, dermatitis herpetiformis, and gluten sensitivity. Celiac disease is also known as a coeliac disease, celiac sprue, non-tropical sprue, and gluten-sensitive enteropathy, which leads to the damage of the microscopic projections of the small intestine called villi. The symptoms can be mild or severe. Dermatitis herpetiformis, also known as DH and During's disease, is a skin manifestation of celiac disease. And gluten sensitivity is not celiac disease. Although similar, gluten sensitivity is much less severe than celiac disease. There are many signs to help you determine if you have an intolerance to gluten. If in doubt, get checked. Celiac disease is estimated to affect 1 in 100 people worldwide, with 97% going undiagnosed. If you or a loved one have gluten sensitivity or celiac disease, don't worry. There are healthy alternatives to help you live a happy and normal life.